With the outbreak of COVID-19, the world is faced with an unprecedented situation. As per data released by the Johns Hopkins University, on the 28th of March, the virus has spread to 176 countries and has infected more than 6 lakh people. Separately, in India, the Ministry of Health and Family Welfare states that we have over 800 active cases and have had 20 deaths. As we counter this pandemic with a 21-day lockdown all over the country, a move that was going to restrain everybody in both the formal and the informal sector from moving out of their houses, it's important to understand the legislative framework that exists to help the governments in India to deal with the public health emergency. At the outset, a public health emergency in India is dealt with jointly by the central and state governments. And this is something that's reflected in the Constitution of India as well. The Union List of the Constitution of India empowers the central government to make laws on matters dealing with port quarantine and interstate migration and quarantine. The State List empowers the state governments to make laws on matters dealing with public health and sanitation, hospitals and dispensaries. And finally, the Concurrent List allows both the centre and the states to make laws on the prevention of the transmission of infectious or contagious diseases between humans, plants or animals. The central legislation in India that deals with the pandemic like COVID-19 is the Epidemic Diseases Act of 1897. Under this act, both the central and state governments are allowed to take certain actions. Firstly, if any state government is convinced or satisfied that at any point the entire state or any part of it is threatened with the outbreak of any dangerous epidemic disease and that the laws in place at that point in time are insufficient to deal with that epidemic disease, it can take any measures and form any temporary regulations that it sees fit to prevent or to control the outbreak of such a disease. Additionally, states can also prepare and make regulations for the inspection of any persons traveling by railways or through any other mode of transport, and to segregate such persons, maybe in a hospital or any other form of temporary accommodation, in case they're suspected of being infected with such diseases. Similarly, if the central government is satisfied at any point that India or any part of it is threatened with the outbreak of any dangerous disease and that the laws are insufficient to deal with the epidemic disease, then it can take measures and form regulations for the inspection of any ship or vessel that may be entering into or departing India. Finally, any person who contravenes any regulation or measures that have been prescribed by either the central or state governments under the Epidemic Diseases Act can be booked under Section 188 of the Indian Penal Code, something which can then lead to such people being imprisoned for a month or fined or both. In addition to the Epidemic Diseases Act, the umbrella legislation that tackles with the prevention, mitigation and the preparedness of the country for disasters in general is the Disaster Management Act of 2005. This act defines disasters as any catastrophes or mishaps or calamities that arise from either natural or man-made causes, and which in turn cause loss or damage to human life or the damage and destruction of property. The process of disaster management under this legislation is split between the central, state and district administrations, resulting in the formation of the central, state and district disaster management authorities. And these three authorities are required to work together at all points in time to lay down and to approve policies, plans, guidelines and laws for disaster management within India. This also includes coordinating and implementing the measures that they may formulate for disaster management.